I've heard from companies in this space in the past that one of the most challenging discussions for industry and regulators is to align around, the antigen selection and or the elimination, right, of the antigens for your products here. So I'm curious, A, do you agree with that as being a particularly big challenge? And or, right, if it's not, what would you say has been one of the biggest points of contention, right, between industry and regulators around the regulation of these personalized cancer immunotherapies? And, where do you see that sort of discussion or debate moving in the future? And you're going to close us out, so no pressure.
That's a very broad question. I would agree that, what really comes now with the mRNA immunotherapies is this, how you select the antigens. And that also comes with, the sequencing that you're doing. Where are you looking for mutations in the genome, on the DNA and RNA level? And how then the forecasts are that these antigens will not only be expressed but also be presented and generate an immune response, etc. Right? It's, we are not in a world where you can forecast everything at this point in time. A lot will come out while doing the clinical studies, right?
Yeah.
And so that's one thing. And then on the theoretical side and on the algorithm side, in cancer, pivotal studies take rather long.
Yeah.
And it might be not feasible to consider that you can go into a pivotal study, freeze your algorithm, not change it, and then come to the market with that frozen algorithm. At a certain point in time, you will, and as the field accelerates, you will have machine learning and changes, and likely, rather timely changes. And this also, from a regulatory perspective, needs to be controlled and overlooked controlled basically and assessed. And I think that will be really a challenge. Not only for mRNAs, but with AI and machine learning taking more and more reality into clinical development as such. This will be a regulatory challenge that I think will be rather prominent in the years to come.